Good morning, everyone. Today my topic is trauma. My name is Chong Zhang, MD from Department of Thoracic Surgery, Zhejiang, the first affiliate hospital, Zhejiang University. In class, we should know about these cases. First is a definition. The second is classification. The third is affecting factors. The fourth is pathophysiology. The five is diagnostic workup. The last one is management. After class, you should learn firearm wound and combined injuries. What's the definition or the name of the injury? It is defined as the injury to living tissue caused by an external agent which may cause tissue damage. This is the two pictures. The injury is interactive by two factors. One is the physical agents. The second is the human body. Then the body's energy release and the absorption. So we cause the structural alternation and the physiological imbalance. Then the last result is the injury or the wound. This is the classification of the injury or the trauma. We can divide by force. It's divided into blunt trauma or the penetrating trauma. Or we also divide by the affecting area, just like polytrauma, hand injury, chest trauma, abdominal trauma, extremity trauma, and others. Then we combine the organs. We always learn about soft tissue injury, bone fracture, visceral rupture. So other divided classification we always study after class. How to divide the injury severity? We always use the Glasgow Coma Scale. It is also called GCS score. So what's the definition of the Glasgow Coma Scale? We divide into three parts. One is eye-opening, and the spontaneous, we named 4 score. To loud voice, 3 score. To pain, 2 score. None is 1 score. So verbal response is orienting, 5 score. Confused, disorienting, 4 score. Inappropriate words, 3 score. Incomprehensive sounds, 2 score. None is 1 score. So the best motor response, a base is 6 score. Local slice is 5 score. And withdrawal is 4 score. Of a normal fraction, 3 score. Extension, 2 score. None is 1 score. So we added all the scores into the total score. We always, just for example, hand injury classification, severe hand injury, Glasgow score of 8 or less. If it's more than 9, from 9 to 12, we always call moderate hand score. If the score is more than 13, so we call mild hand injury. The affecting factors we divide to 3 factors. One is aging of the victims. The second is anatomy. The third is mechanism. The elder people has the worst results and high mortality rates. So the older people has difficulty for us to diagnose it. And he has a limited organs reserve, so has a worse results. Anatomy, always the impact resistance. The first rib and the second rib always have easy to trauma. The first rib has the 89% of the fracture. The second rib has 8% of the fracture. So mechanism we always divide into ground impact and penetrate trauma. The pathophysiology always has a very complex. The severe injury and multiple trauma invoke a systematic inflammatory response. So we always cause SIRS. This systematic inflammatory response to major injury is caused hemodynamic, immunological, and hemodynamic response. So after the patient is stimulated by the trauma, so the four systems has been stimulated. The first is a hormone response. The body can secretion the various stress hormones. Mechanical response is catabolism of the bones, muscle, and fat. Increased glucogenesis resulting in the hypoglycemia. And hemodynamic response is included the pronounced peripheral vasoconstriction, retention of the sodium chloride and water, and a translocation of blood from the peripheral to central vital organs. The last one is immune response, is kidneys, arachidocide, metabolism, and other factors. The phase of the wound healing is included the three stages. The first stage is inflammatory phase. It takes from 2 or 5 days. So included hemostasis and inflammation. The second stage is proliferative phase. It costs 2 days to 3 weeks. It included the granulation stage and the contraction stage. The third part is epithelium stage. The last one stage is always we know that the remodeling phase. It costs from the 3 weeks to 2 years. And it included new collagen forms which increase tensile strength to wound. Scar tissue is only 8% as strong as original tissue. So the trauma can we cause the two response. The first is the layer. The second is the SIRS. What's the name of the layer? A series of local cerebral and vascular response which are triggered when the body is injured and invaded by the attitude. The stage can include the 3 stages. Just so we always know before. Inflammatory phase, the granulation tissue stage, and the remodeling stage. The symptoms and signs is killer, fever, rubor, redness, tumor, swelling, dolor, pain, and function lesser is always cause loss of the function. The most common the results of the trauma is SIRS. What's the definition of the SIRS? Is the definition of 2 or more of the following symptoms. One is the fever is more than 38 degrees Celsius or less than 36 Celsius degree. The heart rate is more than 90 BPM, and the respiratory rate is more than 20 BPM, or the PaCO2 is less than 32 mg. The fourth is abnormal white blood cell is more than 10,000 millimeter and is or less than 4,000. The stage is always divided to 3 stages. One is the stage 1, the second is the stage 2, and the third is the stage 3. The stage 1 is definitely demonstrate that the local cytokine is produced with the goal of the inciting an inflammatory response. The stage 2 is the small quantities of the local cytokines are released into circulation to improve the local response. The stage 3 is if the homeostasis is not restored, a significant systematic reaction occurs, the cytokine release leads to destruction rather than protection. So the precipitate factors is one is the construction of the microcirculation, the second is the tissue swelling, and the third is antigen like bacteria, the fourth is mistreatment, and the last one is malnutrition. The consequence of SIRS always most of the time is recovery, but sometimes some people will got pulmonary dysfunction, cardiovascular dysfunction, renal dysfunction, and gastrointestinal system dysfunction, metabolic disturbance, and hematologic dysfunction. What's the diagnosis? How can we do the diagnosis? One is a complete medical history. It's the most important. When, why, how, where, which, post-trauma symptoms, allergen, drug history. The second is a vital signs, asphyxia or shock. The third is the lab results, including the CBC, CMP, ABG, PT, immunotest. The fourth is a radiology, including X-rays, ultrasonic, computed tomography, MRI, CTA. The source is always the temperature is more than 38 Celsius degree or less than 36 Celsius degree. The tachycardia, response rate, and white blood is more than a certain status. Sepsis is always caused due to the severe infection, always cause bacteria within bloodstream, confirmed by cultivation. And so the sepsis always result into bacteremia, presence of the bacteria with the bloodstream, but this condition does not always lead to SIRS. Sepsis introduce hypertension, always cause just like shock. So the presence of systolic blood pressure is less than 90 mmHg, or a reduction of the more than 40 mmHg from baseline in the absence of the other cause of hypertension. The most severe results is a multi-organs dysfunction syndrome. They always called MDOS. How to management the trauma is most important for our surgeon or other doctors. So we always know the first part is the most important is the first aid. So how can we do that? Is the first to check the airway, clear it if obstructed. Then we feel the pulse, recover the appropriate position. Just an unconscious patient, take special care of the cervical spine, stop oncoming traffic, treat the patient, cover exposed bone, reduce refracture, stop bleeding. Always call the emergency rescue and wait for ambulance. Just like this person, two patients. The second part is the initial management. When the patient is sent into the hospital, we always know should observe the vital signs, set up records of the temperature, pulse, respiratory rate, blood pressure, pain, level of consciousness, pupil size. Complete examination, cut the growth, do not pull out. Measure the wounds, examine the every bones. Then we record the ECG. Then set up CVP line. The normal range is from 4 to 8 centimeter H2O2. ISS grading is ISS injury severity score is from 1 to 75. If the score is more than and 16 is definitely severe, is more than 20 is high mortality, is more than 50 is few alive, if it's more than 75 score, so almost impossible to cure. So the last one is always we needed is advanced life support. So after first aid and instrument, so the trauma patients will always define it as the following three categories. The first is immediate resuscitation. When the patient got cardiac arrest, asphyxia, extensive bleeding, open pneumothorax shock, visceral rupture, so we always do resuscitation. The category 2 is general trauma treatment. We divide into the local treatment and systematic treatment. The first is the local treatment. We always do immobilization, emergency surgery, reduction and fixation, soft tissue injury in treatment, just like physical treatment, cold within 48 hours, hot with more than 48 hours. And the second part we should do is a systematic treatment. It includes always maintaining efficient circulation. We should use saline, lingers, blood transfusion, maintain airway and breathing, just like support the patient with oxygen inhalation. Then we prevention the secondary infection, use prophylactic antibiotics, maintain the metabolic and nutrition balance, pain control, and psychological treatment. If the patient has mind, so the specialist should do the systematic review. Just we do not know the urgent injuries, do not do the just like the immediate resuscitation or the general trauma treatment. So the surgical wound, if the patient got the injury, so most of people we got the injuries wound. We divide into the surgical wound into class 1, class 2, class 3, and class 4. The class 1 is clean, so it's very easy to deal with. And so just no break in, just the definition is operating wound clean, no traumatic with no inflammation in count, no break in technique, respiratory, gastrointestinal, genital urinary tract not entered, cases section, elective, no pre-rupture of the members or trial of labor. Class 2 is from the clean to contaminated. It is just the name is operating wound clean, or from the clean to contaminated. Non-traumatic wound with minor break in technique. The third is gastrointestinal, respiratory, genital urinary tracts entered without significant spillage. The third, the class 3 is contaminated. It included just operating wound contaminated from fresh traumatic wound from clean source. Operating wound with a major break in technique, gross spillage from the gastrointestinal tract, entrance into the genital, urinary, or urinary tract. When the infected urine or the bile is present, so incision encountered acute non-prolonged inflammation. The last one is dirty infect, just always caused by the bacteria. Thank you.